when you think about what kinds of things at a big picture level you might expect from a trauma-informed mental health provider, right? Like most of us on this call, or most of us on this echo, um, trauma-informed mental health providers are all going to be mandated reporters. We're going to be thinking about who do we need involved if it's relevant, if we have to make a report, right, to keep a child safe. So what other additional systems or supports are going to be needed? They're often going to be doing some sort of trauma specific assessment to better understand the nature of the trauma. And again, one of the reasons for that, as Aaron was talking about, is going to be to try to think about what kinds of issues are going to need to be addressed in those tier 3 treatments that Melissa talked about, right? So we're going to be doing some kind of trauma specific assessment to some degree to more clearly understand the nature of what we can about what a child might have gone through. And then from there have to think about, what's a treatment plan. So a good trauma-informed provider is going to be thinking about how do we come up with a plan for intervention, a rationale for intervention, thinking about what path forward is going to make the most sense, thinking about best practice evidence-based treatments for kiddos who are presenting with specific trauma-related concerns, right? So expect that from a provider, regardless of what modality they're using, right? Those are at least things that I think that we should all kind of expect from providers. We're going to be talking a bit just today, sort of informally, and introducing some concepts from one specific tier 3 intervention that was already mentioned, trauma-focused cognitive behavioral therapy, and then talking a lot more about that next week. And thinking about how you can implement some of that. But I think it's just important to be mindful that at a big picture, these are all going to be things that you want to consider. And in line with sort of the idea that we've talked about both today and then last week, we want to think about how to effectively collaborate, because I'll say that as a mental health provider, right, when I've worked with trauma exposed kiddos, I think it's often very helpful to know what's going on in the child's environment, both at home and at school, because we want, as therapists, the work that we're doing in the therapy room, right, or if we're using televideo platforms or video conferencing platforms, right, in the virtual web room, right, regardless, we want to know that what's happening in therapy is translating to the world outside of that therapy environment, right? We want improvements in therapy to translate and generalize to other parts of the child and family's life and their lived experience. So that includes the classroom, that includes what's happening at home. So it's often helpful to collaborate. And so with that, on this slide, I included some things that's helpful for us as mental health providers to know, but I also want to say that, I think it's important for me to say that I think it's helpful for me to share with everyone what I'm doing, right? What my treatment plan is, what some of the specific skills we're working on are, because that's going to be important when you think about how to make sure that, we're all sort of doing the same thing in different environments to help support the child and provide some consistency in things. So I think it's important for us as providers to share with folks what it is we're doing and the rationale for why we're doing it. If we're using a specific emotion regulation skill, right? If we're using a specific behavioral management strategy, what is it? Why are we using it? And how do we sort of share that information with others to create some consistency? But it's also, I think, helpful for you to think about sharing with providers things that are going to be useful for them, right? So if we're thinking about addressing emotional and behavioral problems in therapy, for example, what kinds of emotional and behavioral problems do you see happening in the classroom, if any at all, right? If you're seeing changes, right, whether worsening or improvements that are happening in terms of any emotional or behavioral problems in the classroom, that's often going to be very, very important to share with providers, I think, because providers can use that information to also track treatment progress, right, beyond just using the traditional PTSD symptom measures, for example, that we might often give kids and parents to report on any improvement in symptoms, right? I think we think about mental health treating trauma-specific kinds of symptoms, but at the end of the day, we really hope that that translates into improved functioning and improved quality of life for folks, right? Whether we're talking about kids or adults. And so, are you seeing those improvements happening? Or are you seeing no changes or deterioration? All that's going to be really, really important. When it comes to learning problems, right? What kind of learning problems are you seeing happening in the classroom? And I think it's important to share that with providers so that we can better understand the nature and extent to which trauma-specific kinds of symptoms might be impacting a child's ability to perform in different kinds of areas, right? So if you're seeing that a child that you know is being treated for trauma-specific kinds of issues, is having difficulties concentrating, paying attention, right? Often seems really distracted. Those are going to be important things to share with the treatment team, I think, because that sort of points us towards more specific directions for thinking about intervention strategies that might be most appropriate, right, during the therapy hour that we have that week and in the coming weeks. So what kinds of things are you seeing there? And that's going to be really helpful to share with your providers. Good evidence-based treatments for trauma-related problems have specific kinds of techniques built in to help address these kinds of concerns. And we'll talk more specifically about what that looks like in TFCBT next time. But I think sharing that kind of information is often helpful. And then if there are plans for educational supports, if you notice that specific symptoms that have persisted, right, and are negatively affecting a child's ability to learn in the classroom, and there's a need for educational supports or an IEP or something like that, it's often helpful to involve the therapist again, just to make some specific recommendations about things that maybe we're working on in therapy that can also be appropriate for providing support in the classroom as well, just to make sure that everybody's providing consistent support. And that really creates a lot more opportunity for learning and reinforcement of specific evidence-based principles across settings and contexts as well. And so I think one thing, just saying all that, that's also important to keep in mind, and this is important from both a safety, transparency, collaboration, perspective. When we go back to all those basic principles of trauma-informed care, it's going to be important to make sure that in exchanging this information, right, we always get consent from a child's parents or legal guardians before exchanging information, particularly with any community-based therapists. So if you as an educator or someone else in a different system are working with kiddos, and you're exchanging information about what you're seeing happening, right, with a therapist, especially someone outside of that system, make sure that you have specific consents documented and that you have all of that, that you have all of that tracked, because that's also going to help create, I think, more buy-in between parents, between educators, between mental health professionals, and better understanding about what the long-term goals and strategies being used for the best support of the child are going to be. So I think that we just want to make sure that we do all that in a way that creates better buy-in, protects confidentiality, and ensures trustworthiness, transparency, and safety for everyone involved. So with that, let me just pause here for a second, because I wanted to pose a question to all of you. I've talked about some things that from my perspective are important for me to share and that are also helpful for me to hear from other folks that might be working with kiddo. But what specifically for folks that are here with us today, for friends that are with us today, what do you wish you would hear from others that are involved in the child's care? What are some things that you think would specifically be helpful for you to know in working with trauma-informed mental health professionals that might be connected with kiddos that are part of your systems, classrooms, whatever the case may be?
Yeah, and you can unmute or put it in the chat, whatever feels best.
Yeah, so Janice, yes, I noticed you said what triggers a student might have. So if we, in the context of therapy, know that there are specific things that are likely to upset someone and trigger someone, right? And Sarah, it sounds like from your perspective too, that's going to be an important thing to know. So yeah, absolutely. Thank you for sharing that. I think that's certainly going to be an important piece. If we can learn to anticipate our triggers, right, then we can start to implement plans for how to manage our reactions to them. What helps to regulate? Yeah. So if there are certain things that are really going to help soothe the kiddo that can easily be used and applied in a classroom, why not use it, right? Why not use those things? Yeah, no, I think triggers and thinking about what helps you regulate, what helps soothe you. Yeah, those are all excellent points. Yeah, what strategies you're using to regulate, right? So that can also be embedded at school. So Sharon, thank you for sharing that. If there are specific things that are there, we have to take kind of an idiographic approach to this, I think, to understand what's unique and what works for this child, right? So learning how to manage reactions, anticipate triggers, and think about personally relevant strategies for managing reactions to those triggers is huge. Yeah, what coping skills the child's learning and what the student's learning. So absolutely, Barb, thank you for sharing that. No, I thank you for sharing that. I think these are all really important points, and it's good for us to know, because I think that this creates, just even in us thinking about this, a collaborative environment where we can all begin to think about what's important for us to share, as well as, things that are helpful to hear from all of you as well. So thank you for that. For those of you who have worked with mental health professionals who've been connected with kiddos that you've worked with along the way, if you have exchanged information or collaborated with professionals, I'm curious what kinds of things have been helpful when you've exchanged information with folks, if anyone here has. And maybe maybe folks have not done that before, and that's okay too. But if you have, I'd be curious to hear your perspectives on that. What's been helpful in the past? So maybe this is kind of a new idea, right? And then it's that. So Sharon, you said just be honest and open conversations to share what they're going through and what they have gone through, right? And I agree. I think that can be really valuable. And I'm curious what's been most helpful about that, the honest, open exchange of information. The family background. So, I mean, yeah, so just the honest, open exchange, for example, even in knowing about the family background, can be really, really important, because I think that helps you understand what kinds of supports the child might have in place outside of the classroom, right? For example, what kind of things to be mindful of and what kinds of accommodations or things might need to be made. I think that's all very important to know for sure. So thank you for sharing that. Yeah, from an individual needs perspective, yeah. So just making sure, that we can meet them where they are, and through having open, honest exchange about the systems that are part of the child's life, right? We can begin to better anticipate how to meet them where they are. And so Megan, let me pull that up. It sounds like you'd mentioned that it's a challenge to consistently communicate with providers. Yeah, and I think that's absolutely true. I think that can be a very real challenge to communicate with providers. What are some of the biggest challenges that you found in communicating with providers?
I have found that oftentimes what the providers see or hear from the family or the child isn't always exactly what we see in the school setting.
Mm-hmm. So you see, so you get very different, the behaviors are more contextualized, right? And so you get a very different glimpse of what the child's experience is.
Yes.
Yeah. Yeah. Someone here, let me see. So having a good plan, particularly, it sounds like a diverted plan is helpful to foster parents, relatives, right? Oftentimes the plan says more training that's really non-specific, right? So yeah, so getting more specific information, I think specificity, right? When you're thinking about a plan of action can be really, really important. And sometimes you don't get a lot of very specific information from providers. And then Jamie, you said it has been helpful when mental health providers share the parents' concerns related to the school, right? And I think that's a really important point. That's an interesting point. Sometimes a change of setting, person to share, helps facilitate more conversation and problem solving. And then Sarah, you added here that as a mental health professional, you sometimes find that relating a child's strengths, likes, and dislikes can help people in the school setting and forming connections, right? Probably with kiddos and with families in some ways too, I imagine. I'm curious if there's anything you'd add to that to elaborate on that, Sarah. And you don't have to, that's okay. But I think that's a really good point. I'm curious what kinds of connections you specifically meant there. Yeah, so Barbara, you said cooperation, right? Can only assist in the evaluation of treatment. So absolutely, I absolutely agree with that. it could be a reference point when a child's dysregulated. Sarah, yeah. So thank you for going back in and sort of adding that point. Yeah, I think that just having a good baseline, right, and knowing what's going on and where certain problems are likely to be more contextualized can even be helpful for us as providers, I think, to know, and thinking about specific triggers and coping strategies that are going to be relevant, right? But it's helpful, and Rachel, you added this, it's helpful when the school and providers are on the same page with coping skills, behavior plans, et cetera. And I agree. And I think that to the extent that providers can be more specific and can get more specific information from other folks involved in a kiddo's life, right? Because we're all part of the same interconnected system, that's going to allow for a lot more specificity. And I think at least opens the door for us to be more mindful about specific triggers, coping skills, strategies, right, that are likely all going to enhance the kiddo's success across contexts and settings. Anything else that folks would add? And Aaron, Melissa, I don't know if either of you have any thoughts about anything that's said, but these have been great thoughts. And I think help us think about real challenges that can come up in communicating, right? And how to open communication between providers and other folks in a kiddo's life across different systems. But any other thoughts that other folks have, and or Aaron, Melissa, that you have?
I think the one piece that I just wanted to add in is I do feel like it's helpful when we are talking about how challenging it is, one, just to validate that it's hard because this is hard, right? And so it feels hard because it is. We're talking about, different folks with different areas of expertise, with different kinds of relationships to a child and their family and a context, kind of trying to communicate. So it is very, very challenging. So just want to validate that, and then also say that it is possible. So I've certainly worked with a number of school mental health and school providers and professionals and community mental health providers who've never really seen it work in terms of that collaboration and that connection. And so I just kind of want to offer that glimmer of hope that it can work. It's challenging, but when it does work, it's amazing. And I think there are ways to make it easier and to have that effective communication kind of be put in place. So if you are in a place where you've tried before and it hasn't worked, stick with it. And hopefully we can kind of talk through some really pragmatic ways to facilitate better communication across these systems. Again, it is hard, but it can work, and I have seen it work. And I've seen systems work together more closely to kind of make it work for more and more kids.
Yeah. And, we talk a lot in groups that I work with about how children who are in need of tier 3 supports need a lot of supports, and it's hard work regardless. And so really focusing on how do we leverage the system instead of fighting against the system is going to be important here. It does take time to help. And how can we work together from a systems perspective, use a perspective that's arguably more trauma informed so that maybe we can help get further down the road than we have before. But it is hard. It is exactly where a lot of the hard work comes in.